Hi, I'm Deb Dietz with Raising Confident Parents. Today, I'm sharing a sneak peek of the Raising Confident Parents online course, where pregnancy and infant care experts Pam Jones and Pat Corey teach you what to know about pregnancy, how to prepare for labor and delivery, and what to do once you bring your new baby home. Today, we're sharing a sneak peek of Module 4, your hospital stay. And in Module 4, there are 5 lessons: hospital hints, common parent questions, adjustments, how to introduce your newborn to their siblings and the family dog, before going home questions, and postpartum complications. So here's a sneak peek, a quick look at Lesson 5, Postpartum Complications, where Pam Jones interviews new mom, Dr. Catherine Taylor, about her postpartum experience. It's a story you need to hear. It's a cautionary tale that oftentimes after the birth of a new baby, everyone is so focused on the baby that oftentimes issues with mom go overlooked. Here's Catherine's story.
Can you just tell us about your postpartum experience?
Sure. So I had my twins about 6 years ago, and prior to that, I had two daughters, they're singleton pregnancies, and really normal deliveries and recoveries with them. So I had a really smooth pregnancy with the twins as well. I went all the way to 39 weeks in one day, which is pretty much as far as you can absolutely go with twins. So I didn't know a lot about complications. I didn't really even know quite what to look for. So I went into the birth, and the doctor had recommended me for a vaginal birth because I had had two successful vaginal deliveries, and the babies were both head down. So I delivered in the operating room, but as anticipated a vaginal birth. My daughter, twin A, came out within a few minutes vaginally. But then when I went to go push twin B out, my son, we started to hit some complications, and long story short, we had to go into an emergency C-section. So, the recovery from that, both the vaginal and a cesarean delivery, was obviously a lot and not something I quite knew how to wrap my head around and anticipate, and especially because I was coming home to, 4 kids, 5 and under. So it was kind of a lot to take on. And but my recovery process in the hospital was pretty normal, I would say. I went, stayed the average 4 to 5 days after the cesarean to, be monitored and make sure everything was okay. I did have a hemorrhage during the birth process, like when the placenta was coming out. So I was aware of that. But other than that, I was just kind of told the standard, if you're bleeding, call us and whatnot. So I didn't really know what to expect. So I went home, had the first night at home with the kids, and then the next afternoon, I was actually reading to my oldest daughter a book on the couch. And I remember reading to her, and I started to feel like I was losing vision on the right side of my and I kept seeing these flashing lights, and I couldn't see the words anymore. And I'd never had that experience before, and I didn't, really know what was happening. So thankfully, Pam, you were there helping me take care of my kids. And I just remember going up to you and saying, I think something's wrong. I can't see. I was not smiling though. I had a look of panic on my face. And
You were one of us smiling.
I was like, I can't see the pages. I can't see the words on the pages. I'm having trouble seeing. So Pam was, very calm, told me to go ahead and lay down. Luckily, knew or had a suspicion of what was going on, and sent my husband out to go get a blood pressure cuff from Walgreens, which is down the street from us. So I was laying on my bed, and Brian came back about 10 minutes later, like rushed in with a blood pressure cuff. And I just remember like my heart was racing, and I was still having trouble seeing, and I got clammy and just like wasn't feeling. I knew something was wrong, and took the blood pressure, and it was like very, very high. And I think it was like 180 or 90 over 200. I mean, it was like really high. And remember, we called the doctor. Brian called the doctor, and the doctor said, if you have to drive on the side of the road, but get down to Northwestern. So, I headed down, and they readmitted me to the hospital, and upon further evaluation, they wanted to make sure something wasn't going on neurologically. So I regulated. They sent me home on blood pressure medications. So I had to, keep that under check. And I went in once or twice a week for a while. I'd say for 3 to 4 months for blood pressure checks, because it would occasionally just start spiking again. So it would just sort of similar situation where I would be completely fine, and then all of a sudden it would kind of go back up again. So, but there were a lot of silver lines in it. I really learned, I learned a lot about recovery, and there were things that I had not experienced in my previous pregnancies that I started to learn about and understand. And I really also started to learn how to, as a clinician, I knew how to talk to people about mindfulness and, staying calm in a difficult situation. But it's another thing to really have to apply that to yourself, especially while you're busy trying to take care of kids and figure all that out. So there were a lot of tips and techniques that I learned to really get that help and that I needed to kind of let my body and my mind recover from everything I had gone through. So I'll pause there and see if you have a question. I'm happy to keep talking too.
Oh, sure. Well, and that is the problem, one of several, you're a very educated mom, a very educated woman, and you didn't know that something like that could happen when you got home. And, when we all come home with the babies, all the attention's focused on the babies. Is the baby okay? Are they eating enough? And so everybody seems to kind of forget about the mom. And, well, her work is done, she's fine. And so what I was finding, over the years, especially after your situation, that so many new moms that came home had no idea about the complications that could happen once you came home. And it was really scary because, you being very educated and already being a mom, makes me even more worried about, maybe moms that are not so educated, first-time moms, moms that don't have support, and they're seeing things, but they're, oh, well, no, it's nothing, it's nothing, because I even remember very clearly you saying to me, I think I have a migraine. I'm going to take an aspirin and go lay down. And me say, no, you're not. And you're like, why not? And so, it just worries me so much that, since then, and we've had so many moms that I've talked to that, don't know that you can have postpartum preeclampsia, don't know what to look for, headaches, blurred vision, upper right-sided, upper gastric pain behind your ribs, dizziness, even, subtle things, just lightheaded, nerves kind of hit you like, okay, yeah, I'm sorry, this is not a migraine. We're not going to give you aspirin and pack your bed with ice. If the blood pressure comes back and you have low blood pressure, okay, but we're going to make sure.
Such great information, and information that's not well known to new moms. In our course, Pam and Pat will teach you exactly what you need to know throughout your parenting journey, from the moment the pregnancy test turns positive to sleep training your toddler. Pam and Pat have worked with over 1,000 babies and their parents, and their lessons include information not only from their experience, but also includes interviews with experts, other healthcare providers, and new parents like Catherine, who add value to the lessons. Some of the lessons are difficult, like Catherine's story, and things that you'll learn that you'll never ever read in any book or in anyone else's course. To learn more about Module 4, your hospital stay, and all 10 modules of our online course, click the link in the description of this post. And I invite you to visit our website at raisingconfidentparentsonlinecourse.com and like and follow us on Facebook. Our Facebook page is Raising Confident Parents. I'm Deb Dietz. Thanks for being with me today. We hope to see you soon. Bye for now.